Okay, this is a very good question again. What is AMH? It is anti-Mullerian hormone. It is an indirect marker of the ovarian reserve. See, we girls are very unlucky. We are born with limited number of eggs, unlike the male counterpart. Okay, so suppose at birth we are born with thousands of eggs, but by the time we reach puberty, those eggs reduce in number, and in our whole life, that is 50 years of from 15 years of age to 50 years of age, I've given a approximation, we ovulate only 400 to 500 eggs. Okay, so that is the only limit we have in our ovaries, both ovaries milake. So what happens with age, with age, or due to some stress factor, due to lifestyle, bad lifestyle, what happens sometimes, this ovarian reserve falls. That is, it is depicted through a low AMH. But that is not the final, like final parameter or final diagnosis. If the AMH is low, you have to go for the antral follicles also. See how many follicles are developing each egg, each cycle. And if the AMH is low, it means that the last eggs are remaining. So if you can correlate it very practically, suppose we have a box of mangoes, and at the end, at the last, जो box के last में जो mangoes होते हैं वो तो इतना fresh and इतना अच्छा नहीं रहता है ना. So जो last के eggs रहते हैं वो थोड़ा सा quality उनका 100% down होता है. तो इसीलिए it lead to, not 100% in all the cases, it might lead to a poor embryo which is not A class. There are grades of embryos, so yes, it might give a grade B or grade C. It might not be the best ones. It is to some extent true, although not 100% in all cases, but yes, it can be. That's why people say, get pregnant early, don't wait till high age. That's the only reason. They're very true.
Right. But abhi, like today's current scenario, if we see that people are, getting married only after
Yeah,
35, late marriages. A
that's
lot
why
of
now. That's
people,
why the thing has been so. Means the rate is going so high of infertility. That is one of the biggest reasons.
right. And this is one question also: why is infertility on rise?
Yeah,
Yes.
our
So,
lifestyle.
right. So here the suggestion for those who are opting for late marriage, it can be that
Yeah,
go for a test, AMH test, or something
yeah, they
like
can
that.
go for a AMH test, and they can go for cryopreservation of eggs. So that can be in foreign countries. It was popular long back because they are more modernized than us. Now we are getting modernized and more ambitious. Ladies are going out for work. They do not have time for early marriage. And also, I would not suggest we have to be professional and we have to be ambitious. So one of the options, if somebody thinks, like I'm going to go for a late marriage, so they can actually go for the AMH and then go for the cryopreservation of eggs. That's a good option and it works nicely. You can preserve it for as long as you want. But obviously, I would suggest, see, the more you age, your physical capacity also goes down, right? So I think you should not delay really a lot. Keep a balance and plan your future. That would be nice. We've got a question. So age, yeah,
Yes. So
Shari?
there's this question that age is 31 and I'm trying for 7 years. AMH is 1.86. 4 IUI, 1 ICSI failed. Doctor is now advising laparoscopy and ovarian drilling and TNC.
Okay. So age is 31, elderly, okay, fine. Above 30, 7 years, very long time. AMH is low. Okay, not very low, but low. 4 IUI means IUI not to be suggested again. 1 ICSI failed. But doctor is suggesting you laparoscopy. I have to, and ovarian drilling. I don't think ovarian drilling is required in your case because your AMH doesn't depict that you're a case of PCOD. We do ovarian drilling in case of PCOD patients, but your AMH is very low to go and disturb the ovarian tissues again. So please reconsult with your doctor, or I am not sure if you have bad PCOD or something like that. That's why your doctor might have suggested. But I personally, if you're not a case of PCOD and if you have low AMH, you cannot go for PCOD drilling. DNC can be fine, a laparoscopy can be fine, but ovarian drilling, I'm not sure. It's not a good option. But yes, you can go. You should go for a diagnostic laparoscopy. Diagnostic laparoscopy will increase the chances of you getting pregnant, because something small, some kind of problem might be, missed by us through ultrasounds and all those procedures. By laparoscopy, we can have a direct view of your abdomen and uterus and every reproductive system. So that is a good option, but don't go for ovarian drilling if your AMH is so low.
Okay. So, although PCOD, PCOS is not the topic here, but बहुत सारे questions आ रहे हैं, and हमारे पास भी बहुत सारे clients आते हैं, calls आते हैं, where they say बस थोड़ा सा PCOD है और सब ठीक है, थोड़ा सा PCOD है. So, what should we explain to them?
देखिए, PCOD is what? PCOD, there is no rupture of eggs. अगर अंडा नहीं फूटता है तो प्रेगनेंसी कहाँ से होगा? So there is nothing called थोड़ा सा and पूरा सा. Somebody has PCOD, मतलब your eggs are not getting ruptured. So you have to treat your PCOD. You have to be really very, very careful and very, very active and conscious about this matter. But I would say, being a clinician, it's very easy to treat. Pregnancy rates are very good in PCOD. See, a patient with AMH, low AMH, matlab kya, anda khatam, but PCOD full of anda. So we can, like really be happy and assure the patient about pregnancy. Only thing is they have to be really careful and conscious about, they have to understand the problem they're having. So if the patient is obese, if the patient has deranged sugars, we have to make sure that they take care, and really do something about it. Then I'm sure PCOD is treatable, and it is not a big problem as that of blocked tubes or low AMH. And if your patients are coming like that, like thoda sa PCOD, dusra kuch bhi problem nahi hai, then you can ask them to obviously consult your panel of physicians and go for lifestyle modifications. Come back to you within 3 months, give them some kind of support, means ovulation induction, some kind of support, and I think they will conceive within 6 to 7 months without any problem.
Right, right. Thank you. So, friends, we are talking with Dr. Ira Biswas about unexplained fertility. Any doubt, any question, you can leave in the comment box. And as doctor talked about lifestyle modification at Fertility Dost, we have fertility coach program where we include a lot of holistic approach and programs like fertility yoga, fertility nutrition, Ayurvedic treatment, acupressure, and a lot many things. कोई भी डाउट हो तो यू कैन आस्क. सो मैम, अभी तक हमने रीजंस एंड कॉजेज की बात करी. नाउ